Are your body's joints making persistent popping and cracking noises? Are you concerned that there might be a problem? We want to make sure you have the information you need to make an informed decision about your health, because we understand how unsettling and worrying it can be when you hear loud popping and cracking sounds emanating from your joints. In this video, we'll go over what these noises can signify, how to determine their origins, and how to handle any potential problems. Let's first examine the origin of the noises. Sometimes, common movements like bending or stretching cause these popping and cracking noises. Everyday joint pops and crackles are what these motions are known as, and they are nothing to be concerned about. A more serious issue, however, can be indicated if the noises have increased in frequency or if there is discomfort or swelling related to them. The noises and the resulting discomfort could be brought on by a number of different causes. These consist of osteoarthritis. Osteoarthritis is a condition that develops when the joint's protecting cartilage wears out. Bone scrapes against bone as the cartilage wears away, causing pain, swelling, and popping and clicking noises. Traumatic injury, damage to the soft tissues around the joint can result from trauma such as dislocations and sprains. As the injured tissue moves within the joint capsule as a result, noises like clicking and popping may be heard. Tendinitis is an inflammation of the tendons that join bones to muscles. As the tendons pass through the joint during movement, it may result in stiffness, edema, and popping or grinding noises. Ligaments and joints that are loose are linked to the joint hypermobility syndrome. Patients may have more range of motion than usual and suffer loose joints. Joint instability, popping and cracking sounds, and an elevated risk of injury might result from this. After listing a few potential causes of popping and cracking noises in the joints, we'll examine how to determine whether your symptoms require medical treatment. First off, it's crucial to get medical help if you have any joint pain, swelling, or decreased mobility. Second, if there is localized redness, heat, or discoloration along with the noises, the joint may be inflamed. Finally, it is advised that you consult your doctor if the popping and cracking noises increase in frequency or intensity. It's crucial to receive the appropriate therapy for the disease if, after examining the problem, you find that the root cause is anything more serious than typical joint pops and crackles. Although the course of treatment for each ailment can vary, it usually entails medication, physical therapy, and/or lifestyle changes. For instance, medications like nonsteroidal anti-inflammatory drugs, NSAIDs, steroids, or disease-modifying anti-rheumatic drugs, DMARDs, can be used to lessen pain and inflammation if osteoarthritis is the origin of the popping and cracking noises. Exercise, weight loss, heat and cold therapy, and assistive devices like braces or canes are other treatments for this problem. It is significant to remember that these treatments should always be personalized for each patient because no two persons are alike. Based on your individual requirements, your doctor will probably suggest a course of treatment. Finally, it's critical to keep in mind that popping and cracking sounds emanating from your joints could either be normal or an indication of a more serious condition. Keep an eye on how frequently the noises happen and whether any other symptoms coexist with them. To guarantee effective management and treatment of the problem, seek medical help if they continue. We sincerely hope this video was useful to you. Remember, it is preferable to discuss your worries with your doctor if you hear popping and crackling noises coming from your joints. I appreciate you viewing.